Which one? The first one or the second one?
The pain medication
Okay.
that was
Sorry. Metacam.
Metacam, yeah. I haven't given her that since early on.
But I'm seeing some deeper breaths. Her wings are still hanging.
Yeah, the wing thing is,
Her eyes seem clearer to me, but the only way to know for sure is to get a sample again.
yeah. I don't, I don't know. Are you in the past? She hasn't been sick very much. You know, like I don't think she had been to the vet for 20 years, almost until she broke her wing. Before that, it had been 15 years at least since she'd seen a vet. And now she's breathing now because she's stressed out. She wasn't breathing on it. She wasn't breathing on it.
What I'm saying is her bellows mechanism seems more efficient now than it was, which is good news.
Well, that's good, yeah.
With these swabs. Don't cut me. And yes, give me a big towel.
Oh no, not that again. Did she go in there? You have a sample in the did she crap in the...
I want to get a sample from the roof of her mouth.
Oh, well, I'm going to get out, okay?
Okay.
You're getting ready to deal with her. Be a good girl. Okay, you be a good girl. You be a good girl. You could be a good girl. Yes, okay.
Her loves her daddy.
She does.
It's okay. It's all right. Yeah. What? It's okay.
Yeah, but we're going to rest now. We're going to rest. We're going to rest. Rest. Yes. Yes. Rest now. Okay. Okay. We have to rest now. We'll feel better. Feel better. Feel better. Feel better. Feel better. Feel better. Think about that squirrel, dead squirrel in the road. Remember that squirrel? Remember that squirrel? Squirrel got run over by a car. Squirrel got run over by a car. Squirrel. Squirrel. Big birds. Big birds were out. Remember? Remember those big birds? Big birds, like Bubba. Big ones. Big ones. We have to get ready to go to the house. Go to Bubba's house. Go to Bubba's house. Did you hear that doggy? Did you hear that doggy? Did you hear the doggy? That's the doggy. 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 That's a doggy. 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 See the picture? The doggy? There's a doggy. There's a doggy. There's a doggy. Doggy. Doggies. Doggy. Doggies. 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 Doggies.
It's time for Miss Amber to go over traffic.
Did you see that?
She's being crazy.
Doggies. Did you see the people? Did you see the people? Maybe that medicine is making you sleepy. Do you think that medicine makes you sleepy? Think the medicine makes you sleepy? That medicine? You think that medicine makes you sleepy?
Is that one of the ones that's in the thing? Yeah, okay, I was making sure because I feel
Think that medicine makes you sleepy? Medicine makes you sleepy. I think it's that medicine. I think that medicine makes you sleepy. That medicine. Medicine makes you sleepy. Medicine. Medicine makes you sleepy. Medicine. Medicine. Medicine makes you sleepy. Feel better now? Did you hear that doggy? Did you hear that doggy? That doggy. Barking. You know about doggies. You got plenty of doggies around. Cats too. Lucy. Lucy and what's her name? Sharpie. You ready to go home and see Sharpie? You ready to go see Sharpie? Are you ready to go see Sharpie? Ready to go see Sharpie? Go see Sharpie. Sharpie. See Sharpie.
I have Pokey. 10 o'clock.
You hear that boy? You hear that boy? Did you hear that boy? go to your house? You get ready to go to your house? Should gum. 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 Wait for the doctor. Doctor's checking. Checking to see what kind of medicine you need. Doctor's checking to see what kind of medicine you need. Checking on your medicine. Checking on your medicine. Doctor. Doctor's checking on your medicine. Doctor's checking on your medicine. Doctor. Doctor's checking on your medicine. Doctor. Did you go to the doctor? Did you see the doctor? Did you see the doctor, Bubba? Did you see the doctor? Did you? I think you did. I think you saw the doctor. I think you saw the doctor. Yeah. Checking on you. Ready to go home to your house. We'll go to your house. Go to your house. Go to your house. Bubba's house. Well, that had a vein. Dad's checking his veins. Dad was checking his veins. 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 Are you getting your picture taken? Are you getting your picture taken? Are you getting your picture taken? Picture taken, 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 picture pretty soon. We'll go home, waiting for the doctor to check on you, see what medicine you need. The doctor check to see what medicine you need. There's a cat. I see a cat. I see a cat. Kitty cat. I see a kitty cat. I see a kitty cat.
Correct.
How long has it been going on with him?
This particular time or overall? I mean,
Overall, has he had it for quite some time?
well, it comes to, yeah, and I've had him on medications different medications over the years, and that's, we'll try something different, see if there's something else out
Okay,
there.
so treated over there?
Yeah. This is the worst it's been.
Did you hear
I've
that?
had him on antibiotics, off and on, usually 3 times, he'll get it about 3 times a year, and self-lacting, and clear it up briefly, and then 2 months later it's back.
Okay.
Did you hear that? He has bugs. That doggy. That's a doggy has bugs. That doggy has bugs. Did you hear that?
Okay, you wanna bring him on here?
Doggy has bugs. Doggy has bugs. That doggy has bugs. Doggy. Doggy. Doggy has bugs. Doggy. Doggy. That was a doggy. Doggy. Find anything new?
New, no, but same problem. Okay. Ow.
She didn't bite it, that's good.
Okay. In veterinary medicine, we always say when it comes to bacterial infections, we would love to get a culture each and every time. Unfortunately, we never do cultures. And it's not that we never do them, it's just that getting the thing off to a lab, especially on the weekend, is always problematic before the bacteria dies. And then, of course, you know, having it grow for them and waiting a week to get the results back is always a pain in the butt. So I have a hard time sending off cultures at the end of the week because I've had too many clients yell at me over the years for there not being any growth or, you know, or things
Waste,
like that. Yeah, waste of money, waste of time.
Now, culture from a blood test.
Culture, no, not from a blood
No?
test, from the actual sinus itself.
Oh,
All right,
okay.
now this is what I'm noticing today versus the other day, okay? The choanal slit, at the very roof of their mouth, is a little slit there called the choanal slit. It basically is the entrance into the sinuses, all right? At the very edge of those, that slit is called little papillae, okay? Papillae are kind of like a function of nose hairs. They're supposed to be very sensitive, let them know if water gets in their nose ahead of time. It also, they're sensitive to temperature, sensitive to humidity, but they function more, you know, more or less like nose hairs.
Yeah.
Last week we had none. Okay.
No hair?
Well, there's no hair on the bird, but the papillae.
No
no papillae. Today we actually have papillae. Now they're still sick and they're still dull, but we still have we have an improvement from last time. The bacterial problem is pretty much the same, but somehow we've made some improvement. There's still a lot of bacteria in there. So we're going to try a different antibiotic that we tried the last time. So far we use a fluoroquinolone like ciprofloxacin, then we've used a double sulfa drug. So we've gotten 2 classes of antibiotics out of the way, knowing that that's not going to make too much of a difference. Next class of antibiotic I'm going to go for is called doxycycline. Doxycycline is a bacteriostatic antibiotic, which means it can affect other types of bacteria that stuff that the last two can't touch very well,
Okay.
especially if they're intracellular types of bacteria or something that grows a little bit on the slower side.
Okay.
The bad news is we probably won't see any response from that until about Tuesday or Wednesday. Okay, because it's bacteriostatic. What that means is it goes into the bird system and it actually stops the bacteria from growing. So all that's happening is the bacteria are dying of their natural lifespan.
Yeah.
Okay, and then of course they just don't replicate.
And the bacteria, are we talking two things? Are we talking the roof of the mouth, hair-like area, which is not healthy, and then are we also talking about her gut when you're talking about bacteria in her system?
Yes, the same bacteria that I'm seeing in her sinus cavity is also quite overrunning her intestines as well.
Okay.
Okay. And morphologically speaking, when you look at the bacteria under the microscope, I'm looking at 400 to 1,000 times magnification, and there I'm seeing tons and tons of cocci. Some of those cocci are formed in a staph-type formation, and some I've seen in a strep-like formation, but they're all approximately the same size. Anyway, so I'm seeing a staph and a strep type of organism in there. But we're overrun by both. And as of today, I'm not seeing as much staph or as much strep, but I'm still seeing a bunch of cocci.
Okay.
So we made a difference. I'm willing to, if I had to put together my CSI hat, look at the fact that we got a little bit of clinical improvement in there by the fact that we got some papillae going back from those clinical edges. We've made a difference. Unfortunately, we've not hit the nail on the head.
Yeah, okay.
Okay. So we're going to try a whole different antibiotic. We're going to go for a bacteriostatic one this time.
Okay. What is her, can she do this forever? I mean, is she uncomfortable or?
I would say, if anything, she probably feels like she's got the flu.
Yeah.
Okay, doesn't feel well. She's not able to breathe as well as she should, or as easily as she should. Have you noticed her sneezing a lot? I mean, for the amount of bacteria that's in there, I think she'd be sneezing like crazy.
No, I'd say she occasionally sneezes, but no, I'd say no. Not sneezing a lot, she's acting pretty normal except for the way she's functioning.
Mm-hmm.
and her normal, just everyday habits are hindered by this. But no, I don't. What usually, if she's gotten sick before, or with the wing thing and all, you can notice that she's not as aggressive. She's a little more laid back. And I'd say she's in that stage. She doesn't bite as hard because she bites me. It's a love bite type thing, but sometimes kind of hard.
Right.
And now it's not hard at all. She just. And by the way, she's taking her medicine real good.
Very good.
And I'm back to just plain straight peanut butter on, mix it on my finger. And so that's real. I mean, I'll tell you what, any medicine that you have prescribed is getting in her, all of it.
All right, excellent.
Yeah, so that's a positive.
Now here's the bad news. This antibiotic is the only antibiotic that's ever made me vomit, and I have seen it cause biting an animal an upset stomach. Okay? There is a dose for twice a day, and there is a dose for once a day, and we're going to do the dose for once a day. Okay.
Forget all the other medicines?
At this point in time, yeah, they're not working. So
Okay.
put them in the refrigerator, save them. I can't tell you how many clients have called me up after a similar situation and said, well, I got some stuff in an emergency. You gave me these two antibiotics about a year ago. Can we try those?
Yeah.
And 9 times out of 10, if it gets you through the night and saves you an emergency fee, we may try something like that.
Okay.
Okay. Well,
And so the medication might make her throw up?
it's just been known to cause some upset stomachs. I've got a stomach from hell. I could eat anything.
Yeah.
Okay. And yet there was one time when I took that antibiotic and I was vomiting within 15 minutes. And
Whoa.
so I always feel sorry when I have to prescribe it. All right. Another thing that worries me. All right, you've just given me a little bit of a hint that we've actually been through this before, but we just probably never saw a vet for it. I've been looking, every time I look at these slides, both coming out the back end and the stuff I'm getting out of the nose. One of the things that's kind of chronic or common in birds is aspergillosis or fungal infections. Okay, I'm not seeing any, but there's a part of me that thinks we may be looking at some kind of a fungal infection later on. So let's clear the bacteria. Let's give me a chance to see what's in there, and we may find out that this has been the bacterial infection, the more acute thing, is secondary to something that's been going on for a long time.
What creates the fungal? I mean, what's that?
Aspergillosis is one of the more common fungal diseases that we see in birds, you know, as far as respiratory tract infections. It's what they call a, have you ever seen bread mold under the microscope?
Yeah.
Okay.
Oh,
well,
no.
All right, well, anyway, it turns out that bread mold, if you look at one individual bread mold, it's got little roots that go into the bread area, it's got a stalk, and at the end of that stalk is a spore. The aspergillosis is pretty much the same thing. The bad news is when it comes to these spores or the fungal part, I can put them on an antifungal that will take care of the roots and the stalks and things like that. But once it becomes a spore and it makes that spore can last for almost ever. Okay, it is. So in other words, when an animal gets or is diagnosed with aspergillosis, 9 times out of 10, I will see them several times over several years for treatment of that very disease. Because
What causes that?
It's normal. It's in the environment. Almost every bird of prey has it. Although this isn't a bird of prey, you know, I mean, it's just common for birds. Their respiratory system is set up to be the perfect place for that stuff to hide.
And the spongy.
Not so much the spongy part of the lungs, but the air sacs that are on both sides of the lungs. You know, both forward and after and on left and right, they're moist. They've got a very thin wall. The fungi can grow in there, and their little finger-like projections will grow stalks. The stalks will grow the spores. The spores, as they breathe out, some make it out. Some actually fall back into the air sacs and become a seed for another organism later on. Okay, which is why we treat them. Sometimes end up treating them chronically. But I'm surprised. I've not seen any. Okay, I mean, I'm looking very hard for it, but I just, you know, I want, you know, that education is 80% of my job, and if I want you prepared for this some point in time, if I say I'm finally seeing that spore, we'll start the antifungals now, then, you know, we'll know that there's been something cooking for a long time that we were just having a hard time diagnosing.
Yeah. But does that trigger the other bacteria problem?
It can lower the immune response and make a secondary bacterial infection easier.
So the trick is, though, to get rid of the bacteria and this medicine should do that, and it may make her.
Well, this medicine is my 3rd attempt at getting rid of the bacteria.
Is there another step beyond that?
Honestly, let's do this, okay? It is the weekend. I hate sending out cultures, okay? Next week, say I'll be here Wednesday, okay? We can pull a culture then, send it up to the lab. Hopefully it'll make it to the lab before Friday, which means they'll grow it normally. And then we'll know for sure by the next week what it is and what antibiotic to use, okay? I just don't want to waste your money by pulling one today and having it sit in the tube all weekend.
Well, they did a culture, I thought, in Diamond Head. I mean, in fact,
I don't remember seeing any cultures as part of their stuff. They
what
did
is
blood
it?
work.
Blood work, or maybe it's the blood work.
They did blood work, but they didn't do any cultures.
Yeah, I don't know. I mean, I don't know what you could ask her, I guess, but I don't know what she.
I didn't see it as part of the thing. Trust me, if I'd seen that, I'd have been all over it, trying to figure out, you know, what organism it was.
Because whatever she sent, something I didn't understand. It took 2 weeks to get the results back.
Right. It turns out that most veterinary hospitals actually have a lab in-house. We actually have a lab here in-house.
Well, you do a lot more. She didn't do any of this, I don't think. I mean, she never took a couple times.
Well, at some point in time, she held them down and took blood, you know, blood.
They took blood. No, I mean, they did that, but I didn't.
I rarely pull blood from a bird. It's, you know, I find so much information, and I've been doing this for so long, I know the average bird is going to show me a handful of things that are going to be abnormal, and that was pretty classic for what I was seeing.
Yeah.
The calcium-phosphorus ratios were a little bit different in this guy, which was something I wouldn't have anticipated, but other than that, everything else was perfectly what I would expect.
And that medication that she prescribed does not relate to the medication that you're about to prescribe?
No.
Okay.
All different.
Medication number 4. Well,
I will tell you, you know, the culture is, you know, had we done the culture the first week, again, it was later on in the week, and I wasn't sure I can get that sample to the lab in time.
Yeah.
You know, had we done that then, the next week we'd have gotten a name, probably, depending on how fast this stuff grows, would have gotten a name for the organism. I do believe it's a slow-growing bacteria, whatever it is, compared to most. because the average bird would be having a hard time breathing, sneezing. This is a slow-growing organism, but it's still causing the bird some problems.
Yeah. And then, as a result of it, her reaction is drooping the wings and standing there. Okay. All right, well, so we'll see how this works. Maybe by next Thursday or whatever you...
But you may notice an improvement by Monday or Tuesday. I'm just saying, because of the way this is bacteriostatic, if it's a slow-growing organism, then
Could take longer.
it could take a little bit longer to get the results that
Yeah.
we're looking for. I can't say that by Monday you'll see an improvement, but like I did like the last 2 antibiotics, okay?
Right.
It was one of those things like you should be seeing an
Should see
improvement by
it.
this day. If not, then we need to try something separate.
Yeah, I canceled my trip.
I know, I'm sorry about that.
Well,
I really
that
am.
one was all right, but my daughter, who just left, lives in Panama City. She's getting married
Mm-hmm.
the first week in July. We got to have her in good shape because I don't want to leave her with an animal sitter, sick. I don't want to leave her at all sick, but
Right.
with an animal sitter. So, and the animal sitter I think is going to be real good. It's a new one, but I worry about her.
Mhm.
Leave any of my animals sick. But okay, all right. So, just you want me to call in next week on the progress, or?
Yeah, give me a call sometime, early, late next week. I mean, if you're not seeing an improvement by Wednesday, let's plan on getting a culture. Okay, and then at that point in time, we'll switch to a different antibiotic, and I'll try to get something.
Well, if you get a culture, but you're not here till Thursday, so you got to get you want to get a culture earlier enough in the week so the lab will do it and not have to deal with the weekend.
That's what I'm hoping for. Or I hope they'll be able to send it overnight on Thursday to get it there Friday.
Oh, okay.
They have a lab system here. I'm not really sure how well this hospital works with the lab system. That's the part I've kind of been
I
lost.
was thinking it was going to New Orleans or someplace. Is that where it's going?
This particular sample, if I have my way, is going to go to Jackson.
Oh, okay.
But we have to mail it. They don't have a courier system that goes back and forth. And if they
Yeah.
do, then he may be part of it. I'm between hospitals. I never know from the politics from one to the next. So
Yeah. All right. Well, and she's not likely in any pain from this, right?
I don't think so.
Well, Bubba, you're going to feel better now. Yeah, her mouth is open a little bit, so she is, but she's not like that normally. I mean, it's because of now where we are, She's not. I don't see any labored breathing.